Yes, so today we want to look at the concept bipolar disorder, which is one of the mood disorders that we started discussing last week. Bipolar disorder. We want to look at what it is and what are the various forms of disorders that are within the bipolar disorder. What are the symptoms that can come up when somebody is suffering any form of bipolar disorder? I mean, how long can some of the symptoms take? So these are some of the things we look at. Then we also look at how does bipolar manifest in children? How is it managed? And some preventive measures. That is what we will be doing in the next few minutes. And at a point, we will also want to be interactive where we share our knowledge, our views on what we think some of the concepts are. So we are going to start on that note by first having the interactions. So have you heard of bipolar before? If you talk of bipolar disorder, have you heard of it before? And if you've heard of it before, what can you share? What knowledge do you know about it that you want to share with us? If I can get some few interactions before we continue, I'll be very grateful to you. You can raise your hand or you can just mute your microphone and then speak to us. Just share any knowledge you have when you talk of bipolar disorder. Anyone to help us? Hello. Madam Claudette, it seems today all our participants would want to talk to us. All right, so um, let's can we go to the next slide for us so that we move on? All right, so we are asking the question: what is bipolar disorder? So bipolar disorder is previously known as manic depression, and last week when we started, we mentioned that we are actually going according to the DSM-5 characterization or classification of the disorder. So previously, when we talk about bipolar disorder, it is referred to as a manic depression, and that is a mental health condition that
Yeah, hello. All right, so I think that because Jones is in transit, we may have lost him for a second, but he's joining, and so we should kindly hold on tight. I'm sure we'll be able to read a bit of what is on the screen so that we have an idea of what bipolar disorder is before he gives more details. So I'm sure that once we even go through the first what it is, we'll be able to also have many questions to ask him. So he's joined now and he will take over.
Yep. Hello, please. Sorry, can I be heard now? Like the network,
Yes,
I'm
yes, we
somewhere
can
in
hear
the.
you, please.
Okay, very well. I'm somewhere in the Western Norfolk with bad network here. All right, so yeah, so I was trying to explain that bipolar, previously known as manic depression, is a mental health condition that causes extreme mood swings. But before then, the word, if we say something is bi, that means two. So there are two conditions that come together forming this particular disorder. And if you want to use the previous classification to describe it, it is said that a manic depression. So mania, that is mania and depression. Mania and depression. So bipolar here is two conditions. So there are two poles here. One side is the mania or the manic episode, and then the other side is a depressive episode. So we are saying that these include emotional. So at the manic side or at the manic phase, you there are high emotions, also known as mania or hypomania. And then the other side of the pole, that is with the lows, also known as depression. So it is depression and mania that comes together that forms bipolar. So there are two conditions. There are two poles, bipoles. That is what it's saying over here. So if you see the image on the slide, you can see there are two faces. One with uh, almost a teary face and one with a smiley face. So in the individual at a point switch to a particular face or switch to a particular pole, and then at the other time to switch to the other. And sometimes the two can even be blending just like that. So that's what they're talking about, bipolar, two poles that is affecting the individual. So the hypomania is less than the mania. When we go further, we'll get to understand more of these things. So when you become depressed, you may feel sad or hopeless or lost interest or pleasure in almost everything that you do. So those who were with us last week when we discussed depression and major depression, for instance, all the symptoms of depression that we mentioned, when a person switches to the depressive episode of the bipolar, they present the symptoms of depression where they become so sad, they lost interest in things they do, like they even feel the whole world is no longer worth to be living. All those thoughts, feeling less of themselves, comes up. And then in another instance, the person switch, so there's that swing, mood swing. The person swings from that low mood to a higher mood. But this time you're saying that these are extreme moods. So when you see from the beginning, it is saying that when you're talking about a bipolar, it's a mental health condition that causes extreme mood. So the moods here are on the we would like to appeal if you join, kindly mute for us, okay? So the mood swings to the very extremes. One side is the mania, and then the other side is the depression. So when you become depressed, you feel sad or hopeless and lost interest or pleasure in most of the activities you do. And when your mood shifts to mania, that is the other side, other pole of the condition, you feel very excited and happy. That's what we call the euphoria. That euphoria, that high energy that comes in full of energy or unusually irritable. So the individual's behavior becomes a bit of aggression, overly excitedness, some energy just comes in them and they do things that are not usual of them. So that is at the mania phase. So is that's so in 1 minute, this person is having a conversation with you, having a conversation, the person is telling how sad they are, how things are not going on well, they are feeling so emotionally down. Then within some time, the person just switch. Sometimes it's so sharp. And this person is just becoming overly excited. and you just be looking at what is happening. That is what bipolar can bring. So these mood swings can affect the individual's sleep, their energy level, activity, their judgment ability, their behavior, and the ability to even think clearly. And the interesting thing is that because the individual's mood can switch at any time, you can't actually predict what they can do next or what they can even think next. One moment they are thinking everything or they are cooperating so well with you, and then the next moment everything just changes as if it wasn't this person that was bringing nice ideas. Please let's move to the next slide. Yes. So if you can see that there's that movement. Looking at the emotion, it just swings like that from left to right, from right to left. That swing happens. So episodes of mood swings from depression to mania may occur rarely or multiple times in a day, even in a year. So sometimes it can even be in a day where the individual will have this switch. It can be in the week, month, and in the year, multiple times. Each bout usually lasts several days. Between episodes, some people have long periods of emotional stability. Others may frequently have mood swings from depression to mania, or even both depression and mania at the same time. So if you see the image you have on the slide, the individual, that's the mood changing from a depressive phase where the person is feeling depressed, it lessens, comes to a mild one, the person becomes sad, then there is that uh, a timid feeling, then it just swings, it just moves to the other pole where the person becomes happy, then the hypomania comes, and then this time they go into full blown mania, which is a bit sometimes uncontrollable. Please let's move to the next slide. Yes. So bipolar spectrum happens on that, it's a kind of a spectrum. It's on that line where the mood is swinging from one mood to the other. It's swinging, keeps swinging from one side to the other. So from sometimes from the severe mania, it reduces and then gets to depression. It becomes can you get to the extreme form of the depression at the same time. So this is how this mood swings mostly moves. And then you have different forms of bipolar disorder as we said from the beginning. So you can start from the first phase, that's bipolar 1, then move to, you have the bipolar 2, you have the cyclothymia, and then some cannot, cannot even classify with a particular name because it can be a mixture of various moods. So the individual is moving or is swinging across the poles from one pole to the other side of the pole. Please, the next slide, please. But one thing that we should understand is that a time may come where the person has this stable mood. Their mood becomes stable, becomes so normal. So it is not always that they are swinging. They may swing to a particular pole at a time. But within some time, the mood can become so stable, especially when they are on treatment, the mood can become so stable and everything goes on well. You didn't know that the individual is having any problem. And sometimes that is what really makes it difficult diagnosing. Diagnosing bipolar is one tricky thing which needs a professional to be able to do the diagnosis. Because if the person is in a depressed mood and you go to the hospital, they are assessing, it looks as though the person is having just depression. If they are not careful, you may end up diagnosing depression. So you have to have a good history of the individual to know that the mood swings before you're able to tell that this is bipolar. So looking at the types of bipolar, you have the bipolar 1. So bipolar 1, the main characteristics about there is that there is at least one manic episode almost every day. So there is depression, and it will definitely switch to a manic phase. And as I mentioned at the beginning, the manic phase is where the individual becomes so energetic, a bit aggressive, overly excited, and you without actually sometimes there are no basis for why those moods are swinging like that. So the bipolar one, the characteristic is that there is depression and then there is the mania, and at least there must be one episode of mania within the swing in the day. And when you talk of bipolar 2, what is you are talking about? This one, there should be at least one major depression or depressive episode with an episode of hypomania. So one thing, what when we say hypomania is just a less form of mania. Mania is, let me say, the high energetic uh, emotion, that high emotion, that bit of aggression, that is mania. So a less form of it. I mean, the person is not very aggressive, but they are just that euphoria is there. So that is hypomania. A lesser form of mania is hypomania. So there is in bipolar 2, depression is a constant thing that is there. But sometimes there is that switch where the person switch into the hypomania phase. So the difference is that in bipolar 1, the depression is there, but in the day, or sometimes that day, depression may not even show up. The person will present symptoms of mania. That's the aggressive or the overly excited phase. So at least at least one manic episode. But when it comes to bipolar 2, we have it includes one major depressive episode and then an episode of hypomania. Then we have the third one. Some people say bipolar 3, but it's the where the psychothemia. That that one has less intense episodes of depression and hypomania. So the difference here is that the intensity of the swings is not as severe compared to 1 or 2. Definitely there are switch although, but the severity of it is not that much. So the individual will definitely move to the other side of the pole, but they are less intense. So that's the psychothemia. But there's a switch over there too. And that's why we are saying that diagnosing bipolar sometimes can be very tricky because you have to have very good history and then the persistency and consistency, looking at how the changes are happening before you are able to come out to say that this is the type of bipolar. So it can take even someone as much as 6 months to be able to identify that this is the type of bipolar. You can know that because of the history of the swings. You can know that yes, there is bipolar here, all right. Because the family should tell that to sometimes the person is happy, sometimes the person is sad. That swings have been coming. But to be able to differentiate whether it is bipolar 1, bipolar 2, bipolar 3, you need time. You need time. So that's what I'm saying. At least sometimes 6 months may come before you're able to have a clear picture of what form of bipolar the individual is experiencing. Then we have the fourth type, which is called the bipolar disorder unspecified. These are not specified. So they actually doesn't meet the criteria for any other type, but still has periods of abnormal elevated mood. We are not able to put the person in bipolar 1. We are also not able to put the person in bipolar 2. We are not able to also put the person under psychothemia. But the person is having some forms of mood swings. So when it's becoming like that, you can classify that under bipolar disorder unspecified. Please let's move to the next slide. Talking about symptoms. For the symptoms, there are a lot of symptoms. when it comes to bipolar disorder. So bipolar 1, as we mentioned earlier, you had at least one manic episode that may come before or after hypomanic or major depressive episode. In some cases, mania may cause a break from reality. So, like as I said, so mania sometimes comes with hallucinations, delusions, and I presume members who have been joining our presentation over the period will understand most of these concepts. So when you're talking about the hallucinations, we understand the audit where the person is. These are false senses. At the time of while the person is having the manic episode like that, they are hearing voices that are not real. They are seeing things that are not real. They are feeling things on their skin that may not be real. They may be having delusional ideations. And talk about delusional ideations. These are false, strong beliefs. So the person has some beliefs about himself, about society, which is actually not real, but the individual feels that this thing is so real. What things if they are providing them evidence contrary to what they are thinking or they are believing, they still don't believe it or agree with what they are saying because what their mind is telling them seems to be fine now. All right, sorry, I got lost. Please, can you give me a minute, okay? Yes, please, my laptop. Okay, and then my bag. But I'm gonna kindly coordinate for me. Let me position myself properly and get back to you.
Okay.
Yes, hello. Sorry for the interruption. It's okay. So we're looking at the symptoms of bipolar 1. So we are saying that in bipolar 1, the individual will experience at least one manic phase. So I was explaining the manic phase, which include the hallucinations, delusions, and then so we have the positive and then the negative symptoms. So these are the hallucinations, delusions, and then other aggressive behaviors that may be coming around. So this individual is seeing things, hearing voices, having false beliefs, strong belief that even with the contrary evidence, they still don't believe that what you are saying is true. What their mind is telling them is final. So the individual at that point may be having this thought because they break from reality. That's what I'm saying here. They will break from reality and they can become so aggressive. The energy level becomes so intense, increase. And if care is not taken, they may even do things that they are not supposed to do. And at that point, some specific symptoms could include, because of that euphoria, that heightened energy, heightened excitedness that comes, you may end up seeing people, especially some females, can even go nude and post themselves in public. And I'm sure we may have some examples of some of these people because of that overly excitedness that they are experiencing. So this they go through this thing, which is the manic episode. Then after this episode comes, it follows with, or the mood swings to a major depression. So after the person becomes so aggressive, going through all the hallucinations and other stuff, they can just become so calm and then get depressed. So that is how it moves. Then when you talk about the bipolar 2, that's you've had at least one major depression. So this one is it starts from the depression, the major depression. So then with the bipolar 1, the mania phase comes first. Then the switch. In bipolar 2, there is more of depression. So the individual is mostly depressed, and then at a time they get hypomania. Hypomania is a lesser form of mania, which we just explained. So you've had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. So we are saying that the person may not have a manic episode because the mania that comes here is less or is less intense. That's what we're talking about, hypomania. So there may be, so this time around, maybe the false thought perceptions may be there, but they may not get to that extreme, let's say, trying to hurt themselves or trying to maybe when cause confusion, chasing people around. They may not do those things, but they may be having some forms of hallucinations and delusions as well. But the energy level is not as bad compared to the mania itself. But there's more of depression where they are so sad, they lost interest in activities that they used to do. Yeah, so the depression is there. Please, let's move to the next slide. Then talking about the psychothemia. So with this one, is so lasting that the duration can last. We have at least 2 years. So this one, the symptom of the disorder should last at least 2 years for us to determine that this is the third form of bipolar, the psychothemia. So we've had at least 2 years or 1 year in children or teenagers. So for adults, it should be a minimum of 2 years, 1 year in children or adolescents or teenagers, of many periods of hypomania symptoms and periods of depressive symptoms. So in the individual have this switch or swing happening, and if it's able to reach 2 years in adults, we are talking about psychothemia, and in children, we are saying that 1 year. Both hypomania and the depressive episode will be coming interchangeably like that. And I said that these symptoms are less severe than major. Then we have the other types or the unspecified. That is, these types include bipolar and related disorders caused by certain drugs or alcohol or due to a medical condition such as clutching disease, multiple sclerosis, or stroke. So any other condition that is causing these swings in the individual, we can classify that under the unspecified bipolar disorder. Please, next slide. So the symptoms in the unspecified ones as we mentioned. They also include mania or hypomania as well, but they are just less intense compared to the specified ones. So symptoms can cause changes in the mood and the behavior of the individual. But these swings that happen are mostly not predicted. You can't actually know when the person is going to switch. So you can be having a discussion or planning something with the person, and then suddenly the switch just comes like that. They just move into a different mood and may affect, it can even affect relationships, but we'll get to the complications of that. So this can lead to a lot of distress and cause you to have a hard time in life. Bipolar 2 disorder is not milder form of bipolar 1. It's just a separate diagnosis on its own. So while the manic episode of bipolar 1 disorder can be severe and dangerous, people with bipolar 2 disorder can be depressed for longer periods of time. So we are not saying that bipolar 2 is lesser than bipolar 1. They are all unique disorders on their own when it comes to the bipolar disorder. Bipolar disorder can start at any age, but usually is diagnosed in teenagers or early 20s. Symptoms can differ from person to person, and symptoms may vary over time as well. Please, next slide. So let's look at specifically some of the symptoms of mania, that the heightened pull. What are some of the specific symptoms? So when it happens like that, the individual have this heightened self-esteem, where they see themselves to be so powerful, so important, so high status individual. So their esteem levels go so much higher based on their concept, their self-concept, who they think they are. They place that much importance on themselves and wouldn't want anybody to. So if you want to talk to them as if you know better than them, you have issues with them because they feel their ideas are the utmost best ideas. Their self-concept is mostly exaggerated. Who they are is mostly exaggerated. And if they are not careful, there will be issues right now with them. There's also that decreased need for sleep. Because of that energy that is within them, that heightened energy, they find it difficult to sleep. They go to bed and they're not able to get the sleep that they need. They sleep so little and they must wake up and their mind is moving around, telling them all sort of things that they want to do. Rapid speech. They talk so fast. Sometimes the thing they say may not be coordinated or may not making good sense or good meaning. So their speech also becomes disorganized. So they may have disorganized speech. And even their thoughts can be disorganized. While they are saying, as you're having conversation, the thing they are saying will not be matching appropriately. You are discussing something about school and materialize, they are talking about something about the party or something that you don't know where they've gotten that idea from that they are talking about. The thoughts will just be changing and be unrelated. So that is, and racing, the plenty thought coming to their minds at the same time. Then there is a lot of thoughts. This person is thinking about money, where they are going to get money to do something. They are thinking about food here. They are thinking about how their bed is not in shape. They are thinking about their dressing. A lot of thoughts passing through their mind at the same time. Or they have people are not respecting them because of that exaggerated self-importance that happens. And because of those things, they become easily distracted and irritated as well. So easily distracted, easily irritated. Increased goals directed activity. Because of what they are thinking, their thoughts that they have about themselves. They have a lot of plans. They exaggerate plans in a week. They feel that within a week they should be able to achieve something so big. And the plans are mostly things that they cannot really achieve. And if they're not able to achieve those things too, it affects them. Sometimes there is psychomotor agitation. So talking about psychomotor agitation, it can be that restlessness, where this person is pacing up without resting. As they sit down, no, they will stand. They sit, they stand. They cannot just sit at one place. They are always on the move, going, engaging in impulsive or risky behaviors. So these risky behaviors and impulsive behaviors, sometimes that's where the sexual urges also come. So there may be that increase in sexual urge where the individual may start doing things. Can maybe have indiscriminate sex, and as mentioned earlier, they may fantasize with things around sexuality. That's why they may end up even taking pictures, of their own nude pictures, and circulating them by themselves. Or these may have fantasies about people that we may not necessarily have any sexual activity with them, but the mind may be, because of the fantasies they may have, if they are not careful, they will mention some names that they have some sexual activity to do with the person. But most of the time, some of the names that they mention, the individual even doesn't have any sexual ideas about them. But they, because of the fantasies they're having, they may end up mentioning some names that, oh, this person has left with me, this person has done this person has done it. So sometimes these are some of the things that happen, and they do a lot of risky behaviors, drinking and all sorts of behaviors. I think that can be putting across. Please let's move to the next slide. And so when we talk about the depressive episode 2, just as we've mentioned earlier, there is that low mood in the individual, lack of interest in things that they used to previously enjoy doing. This time around, they just lost interest in doing them. These are people who would like to go out with friends. This time around, they don't feel like going out with anybody. It is morning and they are just indoors. They don't want to come out, whether church, workplace, nothing interests them again or nothing excites them again. So they are just there. When their relationships, rather they don't have any interest in their relationship again. Not that they don't want to marry, but there are things that they used to do, maybe the playfulness in their relationship, all those things, they may suddenly just lost interest in them. And sometimes because of these sedentary behaviors that they may be picking up upon, they may end up losing weight because they may not even have interest in eating. So they don't have any interest in eating any longer. And they'll be losing weight out of that. Sometimes to the opposite is true, where they end up eating a lot. That is at the depressive episode of the bipolar. These are the symptoms that happens over there. So because they may end up eating too much junk food and all those stuff, they end up putting on weight, which they usually wouldn't want. Sleep disturbances as well. They go to bed and the sleep is not coming. Either they don't get a sleep or they sleep too much. Psychomotor retardation or agitation, where this time around they feel so weak to do things with their energy. So really how to stand up to do these things, like they just don't have the energy to do that. Even to walk outside or walk into the kitchen to prepare something for themselves, they feel so tired that they can't do the things that they wish to do that, but the energy to just do that is not there. And then if mentioned lack of interest already, excessive guilt. Sometimes when this individual is there, they are just feeling guilty for things that they've not even done. They will be going around apologizing to people. Oh, I'm sorry for what happened. Meanwhile, the person, what did I do? And what they say sometimes will not even make good sense, or something that you never thought of. This shouldn't be an issue. They will come and be apologizing and feeling so guilty about things that are no fault of theirs, but they're coming around apologizing, feeling so bad that things didn't go their way they are expected. Meanwhile, it is not actually like that. Nobody's even thinking about what they are thinking, but that mind is them. They are feeling so bad about it. Poor concentration. They are not able to concentrate to do what they want to do. They're always worried. The worry becomes a lot. The same, we also have this racing thoughts about different things. And this time around, it is rather low self-esteem that comes in, where they feel less of themselves. They feel they are not important. They feel nobody respects them. Like those thoughts, the depressive things that when people are depressed, they go through, they present some of these things. Recurrent thought of death, that is where they become suicidal sometimes, where sometimes they end up, sometimes the person can even go and take knife or want to take medicine or want to do any risky thing that may take their own life. So they'll be contemplating ending their own life by indulging in various forms of activity, overdose of medication, overdose of or taking excess alcohol or other drugs or mixing things together, any risky because of that recurrent thought of death. Like sometimes to know that they want to, but then you have that fear that they'll be dying. So they have the fear that they will die. So some forms of anxiety will also be setting in at that point. I want to believe we are following. Please, let's go to the next slide. So mania and hypomania. We've explained some of this already. So mania and hypomania are different. They are different, but they have the same symptom. Mania and hypomania. Mania is more severe than hypomania, which was explained earlier. It causes more noticeable problems at work, school, and social activity, as well as getting along with others. Mania also causes a break from reality, known as psychosis. So if you see these 4 stages of mania in bipolar, you can see that first one. So the energy level. So we are measuring it based on the energy level, the good mood, and then the danger. But sometimes they can become a bit stable. So when the person is in the hypomania phase, there is that energy to do things. So that's why the restlessness and stuff are there. But the mood may be a bit higher. The mood is higher there because the energy also goes up. The mood also is higher there. But at this point, they may be dangerous, but not too bad like that. So when it moves to acute mania phase, at this point the energy level also increases. The good mood falls. So that's the normal mood to then tend to be reducing. Their level of getting distracted or getting into danger, doing things that are off board may also be increasing. So it goes like that and then moves to the third phase. So that is how the person moves from the hypomania phase to the manic phase. They have the delusional mania where delusions are in. So the good mood will also reduce here, and the person is more prone to a lot of dangers. The delusions, those are false thoughts, false beliefs will also be coming in. The energy level also increases. Then the delirious mania, that is where the energy level, this time the things they do are so dangerous that they can cause harm to themselves, to others as well. So mania and hypomania. So the hypomania is less form of the mania. Please, let's move to the next one. And then manic and hypomanic episodes include 3 or more of these symptoms. So to be able to identify the individual should present 3 or more of these symptoms. Being much more active, energetic, or agitated than usual. Feeling a distorted sense of well-being or true self-confidence. Needing much less sleep than usual. That is reduced sleep provided. Being unusually talkative and talking fast. So having conversation with this person, they are talking so fast and they are not stopping you. The conversation, they keep talking from one thing to the other, and sometimes you are tired of even hearing. But maybe because of the relationship you have with the person, you can't even leave. So you continue to listen to the person. They'll keep talking, they'll hold the whole day talking, talking, talking. Sometimes it can be like this. And they will be talking so fast as well. Having racing thoughts or jumping quickly from one point to the other. Being easy to distract, making poor decisions. For example, you may go on buying space, so they may end up spending a lot. Then if their salaries come, they may buy things that they actually don't need. Or even giving out their money and belongings to people. So this person has got for salary and they are sharing it. Brad, take this. Or I just want you to use to buy credit. Oh, you just take this. Things that they have, their belongings, they can take their addresses. Like, I just wish to give it to you. Oh, take this. By the time they realize their belongings are even getting finished, their salary, by the time they realize they shared all their money. So there be some of these behaviors, giving out their belongings, property, money, and then also taking sexual risk behaviors, which I've mentioned earlier. So these sexual fantasies and indiscriminate sex. These are all things that happens in the manic and hypomanic episode. Or make foolish investments that are not needed because they are not able to make good decisions at that period. So the thing will just come to the mind. Once the thing comes to mind, they ask for the impulse like that. So that's why the impulse buying and stuff will be coming plenty. So that is how bipolar disorder comes here in the manic and hypomanic episode. Please let's get to the next slide. Then with the major depressive episode, so we just look at the manic and hypomanic. So in the depressive episode, a major depressive episode includes symptoms that are severe enough to cause you to have hard time doing day-to-day activities. These activities include going to work or school, as well as taking part in social activities and getting along with others. So the person just don't have energy, the ability to do the things that they used to do. They lose interest in a lot of things. Please, the next slide. And to also get the depressive episode, 5 or more of these symptoms must be present. In the mania or the manic episode, said 3 or more of it. But when it comes to a depressive episode, they are saying 5 or more of it to be present. So having a depressed mood where the individual may feel so sad, so empty, they feel hopeless or tearful. Sometimes they can even having crying spells where you see them tearing. Children and teens who are depressed can seem irritable. So children, rather they be getting angry, their behaviors become very questionable. Anger outbursts and some hostile behaviors may be coming. These are the things that they may be doing, things that can cause them. Having a marked loss of interest or feeling no pleasure in all or most of activities they do. Losing a lot of weight when not dieting or overeating and gaining weight. When students don't gain weight expected, this can be a sign of depression. Sleeping too little or too much, which is mentioned. Next slide, please. feeling restless or acting slower than usual, being very tired or losing energy, feeling worthless, feeling too guilty or feeling guilty when it's not necessary, having a hard time thinking or concentrating, or not being able to make decisions, thinking about planning or attempting suicide, which is mentioned. So we are saying that at least 5 of these symptoms or more should be present for us to also to classify the individual at the major depressive mode. Please, next slide, please.
No, I'm at about I'm gonna get it.
Please, let's move to the next slide. All right, so let's look at some other features of bipolar disorder. Symptoms of bipolar disorder, including depressive episodes, may also include other features such as anxious distress. So when you are feeling symptoms of anxiety and fear that you are losing control, so there's anxiety that may also be present. But the person feels like something will be happening and they are not able to have control over the thing that could be happening. This thought is there. The feeling of apprehension, the feeling of some danger ahead, or they fall into some trouble that they cannot control. Sometimes some of these thoughts come and they become so anxious. They have the melancholic or the melancholic. When an individual feels so sad and have a deep loss of pleasure, the mood just goes so down that they don't have interest in anything again. That's the melancholy. And then with the psychosis, which you mentioned earlier, having the delusional and then the hallucinations, the delusional thought, and then both the positive and negative symptoms as well. Please, next slide. Yeah, so let's talk about the timing of symptoms. So the timing of symptoms may be described as one, it can be mixed. So when you talk about a mix, when you have symptoms of depression and mania or hypomania at the same time, so the individual is having these two symptoms almost at the same time. So it can happen, so the swing can be so fast. So at one point the person is depressed and then the next minute the person is having mania or hypomania. This switch. So when it is like that, we say that there is a mixed episode. They have the rapid cycling. When then if you don't have 4 mood episodes in the past year, where they see mania and hypomania and then major depression. And also bipolar symptoms may happen when you are pregnant, or symptoms can change with seasons. So when we were talking about the major depressions, we mentioned some seasonal affective disorders that happen during some particular seasons or period. So when the weather becomes cold like that, some people, because of they don't get the vitamins as expected, may be having some depressed mood. Sometimes these seasonal issues can also be causing some of these symptoms for the individual. Please, the next slide. Next slide, please. Yes, so I think that the slides you have more, maybe we will continue next time. When we talk about the symptoms in children, then I will allow for questions. Maybe the questions will also clarify more of the information. We may have to continue next time, but Sorry, please let's go back to the symptoms in children. My network. Previous slide, please. Yes. So symptoms of bipolar disorder. No, we are talking about the children. Yes. Yes, please. Thanks. Symptoms of bipolar disorder can be hard to identify in children and in teens. It's often hard to tell whether these symptoms are the usual ups and downs or due to stress or trauma, or if they are signs of mental health problems or even or other bipolar disorders. Children and teens have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from adults with bipolar disorder. Moods can shift fast during episodes, which sometimes you may not even be known. When the switch is happening, it just happens so suddenly. So a child who is crying, feeling down, and suddenly they start laughing without anything that should be exciting them, but they just switch like that. Some children may have periods without mood symptoms between episodes. So sometimes the particular episode that they're having may be prolonged without having the switch. But the most noticeable sign of bipolar in children and teenagers may be severe mood swings that aren't like their usual mood swings. You know, sometimes children, maybe a baby crying, and then suddenly start giving their toy or something to them, they may start laughing. So this child is crying now. Once they start playing with them, they start laughing. It is very normal with children or babies like that. But they are talking about children from, let's say, the ages of 8, 9, 10 into the teen ages. So when it is there's the mood swings, they become so severe. That is not usual of them. So this is how it presents in children too. So as we are looking at the adults, let us also be looking at the children as well. We have other things that we will be mentioning in this very episode. However, I want us to pause over here. One, I may go off running on battery. And then the network is also not stable here. So please, I want us to take the next 10, 15 minutes, interact, ask questions. If you have any question, any clarity you need, ask, just put up your hand. You can put it in the chat box where it will be read. We will continue the slides for within next week. All right. Thank you very much. So please, if there are any questions or any comments, please, let's get interactive.
Thank you, Brother Jones.
Yes,
I want to
madam.
ask a question.
Very well.
Please, this bipolar disorders, can someone who is from 45 up to 60 experience it? Maybe it's not seen early during the person's life until the person is 40, 45, 50, thereabout.
Well, it is possible that they were present during the middle or young adult ages, but was maybe, but just that they were. And then, for instance, that's like we mentioned the psychotic, for instance. Sometimes they can be very prolonged. You can't get this prolonged, how do you call it, duration. And if you test in bipolar 2, in bipolar 2, the depressive phase can be long, and then maybe one hypomanic phase may come through. And one thing is that if the person who is assessing to diagnose doesn't take enough time to observe, the person will be ending up diagnosing the person as depression because the depressive phase is more. And then the hypomania that comes is lesser than the main mania because it's hypomania. So if you're not careful, you may not see it as bipolar. So sometimes, unless it becomes so obvious, so yes, the person can have and carry it into the late adulthood or middle. It can actually be present. But one thing that is for sure is that the individual, the condition was already there, just that it wasn't noticed.
It wasn't noticed. Okay. I asked this because some of the symptoms you mentioned, there's this lady who was just talking, can talk fast and say so many things, and they are not coherent. You pick from here and bring from here. And getting to her later stages, she passed on anyway. When she goes for her salary, she'll share the salary. She'll share her things, her items. She can sign a check before they realize she's giving out almost everything. And then finally, it turned into a dementia. I don't know whether that one too is there, where she doesn't even know her surroundings.
Yes.
She was cut off from reality.
Yes, so it is possible. And then when as the advances in age, and then looking at the symptoms, because the bipolar wasn't picked early.
Okay.
During the earlier ages, when maybe the individual hit, as I say, from 50, 60 going thereabout, the person who fall in a clear dementia category. So it can be or dementia because of the age. Because dementia, somebody with dementia can present symptoms of mania, can present symptoms of depression. So mostly then they forget, but one cardinal issue in dementia is the excessive forgetfulness, where they tend to forget their surroundings, themselves, persons, where this individual will go out in their usual compounds and get lost, sometimes forget vital things. So those are cardinal things of dementia. However, they may also be presenting some psychotic symptoms like the hearing of voices and then the other things like the talkativeness and all those stuff. So with these ones, it needs very good assessment to be able to differentiate, especially if the person is older. But getting to know previous history of the person can let us understand that this was there but wasn't noticed and has moved into this state. So that's why sometimes you say that when we're talking about causes of a particular condition, you say that maybe presence of a different condition may be a risk factor that is bringing this also into the individual. So like, and then as you mentioned, the example we're giving, a person signing out checks, giving out their belongings, there are typical issues when the manic episode comes. That euphoria, that excitedness will come and they'll be doing some of this. So this disorder is so real, it is there, and a lot of people are actually suffering it. And thanks so much for sharing these thoughts. Yes, please, we are still interacting. If any other person have any contribution? Yes, please.
Good evening once again, and thank you for the nice presentation. Please, you were speaking about some vitamins when the person is. I didn't get that well. You mentioned vitamins. If you can speak about it again.
So I was mentioning that in relation to seasonal affective disorder, which was something that we discussed last week as part of depression or major depression. And one form of depression is what they call seasonal affective disorder. And in that, one of the causes or the factors you are saying is when the vitamin D we get from the sun rays, and if it gets to the cold season where the sun rays are not coming like that, the energy you get from the sun, it is not coming. Sometimes it can cause some deficiencies in those vitamins in our system. And as those vitamins reduce, they can bring about depressive symptoms, which falls within the seasonal affective depression was mentioned. Or that's what I mentioned. I hope that is. All right, if there's any other question or contribution, they're still open. You can equally type into the chat box, but unfortunately, I lost the previous one because my network keeps dropping. So if you typed earlier, I can't see it. So you may have to type again, or you unmute and speak to us. But one thing I would like to say is that we didn't finish our slide, but then what I want to say is that bipolar disorder can be managed. It can be managed and an individual can become so stable and go about doing their normal daily activities. But mostly you have to add medicine. Therapy alone is not enough. So in a subsequent next week, we'll look at some of the treatment options, but mostly and then the medication will target the two poles. So they'll give the individual medicines that will take care of the manic episodes, and then also give the person medicine that will take care of the depressive episode. So the person is having two classes of medicine that they take together. So either they are taking an antipsychotic and then an antidepressive medication. So these two, so that it can take care of the mania and then the depression at the same time. Then the psychotherapy comes in to help the person with some lifestyle management and then some other behavioral skills that can help the person cope better. But mostly you can't treat bipolar without medication. That is one thing we should know. Okay, so Irene Saki is asking, can childhood stress bring about bipolar disorder? Oh, yes, childhood stress can bring about a number of mental health issues, not only bipolar, but also perhaps there are stresses that then pass. It can be a risk factor. It can be a risk factor. Madam Claudia, please can you move the slide to the risk factor, or let's go to the causes, and then when you do that, then we end it. And if you can move the slide to the causes and then the risk factors, you see some of these things over there. Okay. I think my brother is not currently with us. So yes, childhood trauma, childhood stress, all these things are possible. There are risk factors that can contribute to any form of mental illness, which the bipolar is also part. And then we remember that I said that bipolar is the presence of mania and then depression. So if this childhood experiences or this childhood stress is what brought about some depression in the child, and then psychosis, it can be that shift can happen. So it is yes that childhood stress, trauma can be a contributing factor. Then the genetic factors are also there, where the individual inherits the gene. Maybe the family, maybe the mother, father, or someone in the extended family has bipolar, it can be passed on to the individual. Environmental factors are also there, which include the stress that you mentioned. and then the other risk factors. All right, please, is there any other question? Currently, there are no new hands up. All right, thank you too. And there are no new questions too in the chat box. We are discussing bipolar disorder. Okay, so in the absence of any questions, I would like to thank you all for today. And I also want to apologize for the inconveniences that came up today. The Springboard Roadshow is doing some nationwide youth conferences, and I'm part of the team moving around. So far, we've done 13 regions. We are currently at the 14th region, Western. So we underestimated the time. I was thinking I could get here before it's 6 p.m. But unfortunately, couldn't do so. The network was also bad. My laptop went off. Hence, the inconveniences were coming like that. But we are very hopeful that next week we'll have a full time and we'll complete this topic and then start with the next one. Being carried out by the Springboard Roadshow and Ghana Psychological Association as a partner. And I'm with the Ghana Psychological Association. My name is Jones Kwesi Tagbor. Nadia, thank you for the presentation. Thank you to Madam Nadia. Yes, finish it. We are ending. The slide hasn't ended, but due to some technical reasons, we have to end now. And we are having discussions now. If you have any questions, any concerns you may want to ask concerning bipolar disorder, we have 5 minutes to take your question and we'll be out for today. Maybe it's unfortunate the device I'm using is not making go back to check my WhatsApp. So maybe you can send a message through the Zoom for me to receive. Thank you.
You chance that come now. Boy, I that come.
On you
You told them to come to my country.
question because I don't have access to your question.